So in this video, you're going to learn about what is good versus not so good physical therapy and what you should do about it. Hi, this is Dr. Steve, I'm owner and founder of Body Solutions. I kind of realized by talking to some of the patients that was telling me that they were at other practices, other locations of physical therapy, and they kind of didn't realize what good therapy was until they came here. Now, I'm not here to talk about how good our services are. I'm here to talk about how do you recognize what is sort of non-conventional, bad, or not the best care physical therapy. Because if you've never had physical therapy before, you don't know what good and bad physical therapy is, right? So I can tell you and give you some direction. So when you do go to a physical therapist, you can recognize, wait a minute, this is not the way good or excellent or high quality physical therapy should be, right? So some things to watch out for. If you walk into a clinic and you notice that most of the people are just kind of waiting around maybe for further instructions to do their exercises, that's a sign that it may not be the best physical therapy. If you look at a clinic, you find that there might be 10 patients to one physical therapist, you know that might not be the best quality physical therapist. If the physical therapist says things like, we don't really stretch you or touch you manually, then that's not going to be the best physical therapy care. In fact, if you go to a clinic and you can see how people are just not concentrating, they may be looking around, just kind of doing their thing, there's really a lack of instruction and supervision. That is not the best physical therapy practice. Also, if you go to a physical therapy practice where there's no follow-up, maybe you had your evaluation and you didn't get any phone call or an email or at least a letter, something asking you how is everything, that is probably not the best physical therapist, right? And so you want to look for places that give great care. And what is great care? Well, we should typically, as a physical therapist, assess you. And even on the first visit, you should have a full understanding of exactly what's wrong with you, what's the cause of the problem that you're having, right? We should be able to find the cause and not just give you, sample treatments or random exercises. You should be explaining exactly what the cause is. You should be explaining exactly what to expect. What is the first phase of therapy going to be like? What is the second phase? And what is the third phase? And how long is each phase? We should be able to tell you pretty precisely how this progress is going to go and how long it's going to take. And what are the expectations from you? Because if you don't have that clear game plan going into this treatment process, then you're at a loss and you don't have as much buy-in into this recovery process, right? So you should be told exactly all that. How long will it take? What will it take? What to expect in each session or each week or each month. And after that, basically, with each subsequent visit, you should be shown carefully how to do the exercises. Because when it comes to physical therapy, a lot of it is just re-educating your body and how to move properly. So there's education involved, not just strengthening and stretching. So a lot of the exercises need to be taught to you. Micromillimeters matter when you're doing exercises in terms of good versus bad technique. So I encourage you, if you're in physical therapy or know someone that's in physical therapy or you're considering physical therapy, these are the things to watch out for. Whether you're in sort of our area in South Jersey or anywhere in the world, you want to look for physical therapists that embody these qualities. And that is what I would consider high quality physical therapy. I'm extremely happy to be able to share this with you, and hopefully it will help you prevent from being experienced and being exposed to what I would consider not so good physical therapy quality.